My name is Adlerian Brown, and this is my case presentation for our current mock session case. My case is about a 33-year-old male. He has been married for 4 years and is a father of two. He is currently employed as a customer service rep in a call center. He describes this as a high-paced, high-stress environment with little to no peer support from his coworkers, from his supervisors, no one. He often has feelings of anxiety related to his employment place and also a little bit of communication and distance in his marriage, communication and distance issues in his marriage as well. He has proclaimed a minimal history of alcohol usage when he's feeling overwhelmed at home after work. And this is his first time seeking out treatment. He has never had any other previous counseling. Now, the client does describe his current problems as being constantly overwhelmed, having some distant behavior with his wife. He has a lack of focus when it comes to his job responsibilities. He has difficulty communicating with his wife, what his issues are, and along with trouble showing emotion, and also trouble falling asleep at night due to constant worry of future stress. He has described this overwhelming feeling like struggling with daily tasks. He struggles with going to work, leaving home to go to work, and it affects his daily functioning as well. So with Adlerian theory, something that is a point of focus is the lifestyle assessment. And as it relates to this client, I felt like these three were the most important to talk about just for this case. So the parenting styles that he grew up with, he did describe a very close relationship with his parents. He relied on them heavily for emotional support along with his brother in his youth. Um, it was a very secure attachment style, but it may have turned too dependent. He has described that in the last few years, they have entered a nursing home, both of his parents, due to their declining health and him not being able to be the primary caretaker due to caring for his family. So he has been struggling a lot with expressing emotions, communicating due to his parents who are now declining health. He's not seeing them as often. He's not talking to them as often. They're not very cognitively there like they used to be. So he no longer has that support that he's always had growing up and also into his adulthood. Early recollections, this goes back to his parenting style. He talked a lot about him and his brother being close, and them just relying on their parents a lot, growing up and into their adulthood. Another point in the lifestyle assessment is basic mistakes. So with this client, his specific one is minimization of worth. He often describes himself as a burden and not wanting to be a burden on his wife with whatever issues that he has. He feels as though they're not as important as whatever she's dealing with as it relates to work and her personal life as well. So he does contain a lot of his emotions, and which can result in him, experiencing some of these overwhelming feelings and continuing to be on edge and anxious a lot of the times. So the diagnosis that we went with is generalized anxiety disorder due to it being related to work and just home life, just general life issues. And the definition of that would be the anxiety and worry are associated with at least three of the following six symptoms. Um, Out of restlessness, feeling keyed up or on edge, being easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbance. So the client has described feeling restless but tired. Um, so having that beat down, tired feeling, but when it's time to go to sleep, he just can't due to racing thoughts. Will fall asleep but can't stay asleep. Things like that. Difficulty concentrating on the work at hand at work, even though it is a high paced environment. He finds himself like dozing off, or zoning off, I guess I should say. Um, and just finding it hard to focus on the work at hand when he's so stressed. So with treatment and interventions that we're going with this client, we have been establishing an egalitarian relationship, um, kind of just explaining to the client what their role is and their responsibility is through this therapeutic process with Adlerian, and kind of taking responsibility and focusing on their actions that are contributing to the results and the way that they're feeling. Um, Also, how the lifestyle assessment relates to private logic. We use lifestyle to determine how they take action in their own life. How are they living? What are their social interests? Um, Also, work and things like that affect how they view their behaviors and how they intend to change them. With self understanding as well, providing the research for the client into unrealistic logic that is causing the issue. So in this case, it's fear and anxiety. So kind of providing the client with things that they can see with results, um, to show them how their logic may not make sense or be unrealistic. That's causing their symptoms or what their behaviors are contributing to. And then providing them education. So those are the interventions that will focus on changing habits and thoughts. So something that the client and I used in one of our previous sessions was the push button technique. So it's basically, think of you pushing a button and then something pops up on a screen. We did talk about, when you're having overwhelming thoughts of anxiety and fear, um, kind of picturing yourself somewhere else that's not as chaotic, that's more calm, more of a happy place. And the client tried it and we implemented it for a session and they seem to have liked it. So push button is one that we've used before. With continued research, I would like to see how Adlerian therapy applies within marriage and family counseling. Due to us talking about his wife a lot, we did talk about him not wanting to communicate with his wife about his issues and if that was related to being anxious to talk to her or if he has a personalized view of communication now that his parents are, in the nursing home and things like that. Um, so I would like to do some further research on how Adlerian can apply within marriage and family, especially with the kids, because not just his wife, he did discuss, being kind of distant from the kids as well and not being emotionally present due to all of his outside concerns. So I would like to do some further research on Adlerian and how that can apply within marriage and family counseling because that may be another step that we would take with the client when he's past his individual um, burden of anxiety and kind of overcoming that and how to tackle that within work and then moving on to his relationship with his wife and his children. And these are my references. I did use the DSM for diagnostic material and then obviously the textbook for some of the Adlerian techniques, interventions, and treatments.